Hello and welcome to today's Power of Knowing webinar, Thriving Under Pressure, Overcoming Barriers to Accessing Resources. Understanding comes from knowing. Caregiving can be quite challenging, and Thriving Under Pressure has been a three-part webinar series that has explored the many facets of caregiving. Today's final part 3 of the series will discuss overcoming barriers to accessing caregiver resources available for underserved populations, empowering caregivers to best serve their loved ones. The Power of Knowing is a free webinar series created by AuthoriCare Collective, a nonprofit organization that empowers people to be active participants in their care journey, enabling them to live on their own terms through personalized support for mind, body, and spirit. To get us started, please welcome our moderator, Risa Hanau. Risa serves as clinical and community educator at AuthoriCare Collective and is also a member of the Cone Health Ethics Committee. She's a licensed clinical social worker. Risa, I turn it over to you.
Thank you, Paul. It is my pleasure to introduce our panelists for today. Patricia, or Pat Gibbons. Pat has a nursing career that spans over 50 years. Her focus has been on home care, HIV, hospice, and community-based care in a variety of roles. Although she retired as the director of Beacon Place, an inpatient hospice facility, after 20 years of service in 2016, she remains a fierce advocate for ensuring access to care. As they say, nurses never really retire, and Pat is no exception. She works as a PRN intake nurse at Pace of the Triad, assessing potential participants for care and services. Pat also volunteers with Mustard Seed Clinic and continues to support the efforts of Triad Health Project. Welcome, Pat. And Ursula Robinson. Ursula is the executive director of PACE of Guilford and Rockingham County, also known as PACE of the Triad, located in Greensboro. PACE is an acronym which stands for Program of All-Inclusive Care for the Elderly. PACE is an integrated, coordinated, person-centered model of care. It is driven by the objective of maintaining the independence of program participants in their homes and communities for as long as possible. PACE programs are the lifelines that enable frail, older Americans to live at home. Ursula served on the planning committee to evaluate the feasibility of the PACE model in Greensboro and was then hired as the first executive director in 2010. Under Ursula's leadership, PACE of the Triad is the third largest PACE program in North Carolina, and it is the first PACE program in North Carolina to provide an alternate care setting to serve rural participants. Welcome. And welcome to those of you joining us for this conversation. We like to begin with getting to know a little bit about who is joining us. You'll see on your Zoom screen a question of who is joining us. It is multiple choice. It is also anonymous. Please check all that apply to you, recognizing that many of us have many different roles on a given day that we fulfill. So not surprisingly, we have many, many caregivers joining us. We also have a lot of advocates. We have a number of healthcare professionals, human service professionals, and we appreciate that you are joining us for this conversation today. As we begin our conversation, I want to invite everyone to make use of the Q&A box on your Zoom screen. It will allow you to ask a question at any time during our conversation, and we will do our best to answer as many of those questions. And because we're talking about resources, I want to mention that tomorrow Everyone registered for the webinar will receive an email with access to the recording of today's conversation and also links to many, many resources, including those that we will mention today. So you can look forward to receiving that and not have to take notes during our conversation today. So Pat, I think to get us started, we are thinking about barriers and how caregivers can overcome those. And sometimes looking to our past experience can be helpful. And you came and you were the director of Beacon Place. And I wonder if you can talk to us about why Beacon Place was created, the particular need to ensure care for those facing barriers to care, and the caregivers who wanted to see loved ones receive dignified care as they were approaching the end of their life.
I think the question forces me to be very reflective about this. And, you know, I had been in Boston and witnessed the beginnings of the HIV epidemic at that time and worked to develop a hospice program in Boston. But at that time, you know, HIV was a relatively new disease. I even was providing care before it was known as HIV. And it was specific populations that were being impacted: homosexuals, Haitians, hemophiliacs. And families and caregivers were so fearful. And they were shunned, the families were shunned, the particular person was shunned. And for many people, oftentimes they learned that their child was dying at the same time that they learned that they were gay. So I had the experience when I came to Greensboro, and but many of the same barriers existed. It was just Greensboro was a little bit further behind than Boston. However, in Greensboro, there was THP that was very active. There were new research treatments. There was a great clinic, good infectious disease doctors, but the fear was still there. Now, we had a forward-thinking hospice at Greensboro at the time, and to be able to develop an AIDS-focused facility as opposed to an AIDS-specific facility was very wise, because it allowed us to serve people with HIV, but also persons with any diagnosis that were hospice eligible. And I think that helped to break down a lot of the barriers. Many of us said, you know, oftentimes when you're dying, it doesn't matter what you're dying from. Many of the caregivers, families and caregivers that came together at Beacon Place learned from each other. So that being said, I think that I was reminded of all of that history with the recent COVID pandemic. And it was caregivers being frightened to provide care. There was a lot of unknowns. So even though the HIV epidemic has quote unquote subsided, HIV is now treatable, but there's still stigma. You know, we've gone from quote unquote the gay community to the LGBTQ plus community. And so there's still lots of misunderstanding, and all communities need care. AIDS service organizations have moved from delivering direct care to being more prevention focused. And I think there's language too that has changed over time. And caregivers, both professional and personal caregivers, anyone providing care and service needs to understand the power of language and positive and negative language. And THP's recent newsletter highlighted some stigmatizing words and preferred language, things like HIV infected person, it should be a person living with HIV, at risk of HIV, vulnerable to HIV, and HIV, and HIV transmission, dirty needles, used needles. The whole premise is don't blame the person who is sick, and just look for the positive way to frame the conversations. And I myself have been both, as noted, a professional caregiver, but also personal caregiver. And, you know, my husband's brother left Boston and went to the West Coast to be in a more open and welcoming environment. And when he got sick, I was the person that they called. And I had to navigate from across the country a different healthcare system, different treatment plans and things like that. And I mean, he's doing fine now, but I have had to make a number of trips across the country to really navigate for he and his partner his needs at the time. So it's not easy.
Well, you have said so much, and one thing I want to clarify is when you say THP, we're talking about Triad Health Project. But I think the language, when you talk about the language that can be not only have stigma, it can be hurtful. It can be not just hurtful in the moment, but it can be cumulative. So as a caregiver, if I am thinking about accessing services and I hear language that is not inviting, that I hear language that is maybe a microaggression or is hurtful or reminiscent of language that I have heard in the past, I think that creates some concern whether will I be accepted now? And that makes me think, Ursula, we have worked together for many, many years. You have worked in the professional space as a social worker, an executive director, many other roles, and have navigated that as a professional, as an African-American woman. And I also know personally, you have been a caregiver for more than one family member. And as you reflect on the conversation of some of those moments where you faced barriers or loved ones faced barriers, and how you personally navigate, but also as a professional help other caregivers navigate those moments where you question, am I going to get what I need? Or how do I get what I need?
It's a fabulous question, Risa. Thank you for having me. Let me start by saying that you're correct. I've cared for multiple family members. The three that I'm going to reflect on today in terms of barriers will be my great-grandmother, whose end-of-life care was in a nursing home. And then there was my mother, whose end-of-life care was in my home. And then my grandmother, who died in her home alone. And the difference in barriers that I perceived that we experienced or that my loved ones perceived experiencing. And I will say that for my great-grandmother, who this was in the 1984, 86 area in terms of time frame, in terms of when she was dealing with failure to thrive, really is what I think was on her death certificate. And so we had the experience of being in the hospital, going back home, and those multiple trips. We also had the experience at the very end of nursing home. I was long distance at the time, and she had daughters who were well in their 60s, caring for her, and grandchildren trying to help as well. But because I was the quote healthcare professional in the family, I was designated as the caregiver to find out everything. But here's one dilemma with that. When you're dealing with your own family, sometimes they don't listen. And sometimes they still think of me as the little small kid in the family and not that professional. I will say very early on, my perception of what we experienced was different than many of my family members. And I think it was because of my experience in the healthcare setting. The fact that I was knowledgeable of the language that's often talked about with healthcare professionals, and many folks who are not healthcare professionals find that language very difficult to understand, but they won't ask questions. And my family was certainly an example of that. If I missed any of the visits at the hospital or in the nursing home so that I could transcribe for my family member what was said, because they're not going to ask, or at least with my grandma, in my great grandmother's case, no one asked, I didn't understand what you just said. Do you mind repeating that? Or could you please say this in a way in which I can understand it? Because I really don't understand what you're saying. So then they would wait to call me, or they would wait for me to arrive, and then they didn't remember most of the story. And you know, so it was that starting all over again. And I have my thoughts about why that is, but I think some of it is that I have family members who did not want to be perceived by the healthcare professionals as being ignorant. I think that they felt looked down upon by some of the healthcare professionals that they encountered. Again, it's all about perception. Whether or not that actually occurred or not is a different story, but it's how it was perceived. And was it perceived that way because of history that particularly African Americans have with the healthcare system, or was it a combination of history and the actual perception and reality for my family in the hospital? So again, back to I'm having to translate language because there was this feeling that they were going to be perceived as ignorant if they asked questions. In addition to that, Risa, there were statements that, and it was so long ago, I'm sorry that I can't remember many of them, but there were statements that were made, and I believe for very innocent statements, but not realizing how hurtful they were. You got to remember, my family was anticipating being either discriminated against or not having care that the lady down the hall who happened to be a different color would get. So they were looking to see how differently, if differently, they were going to be treated. And again, it's all about perception. When we were in the home environment with my great grandmother, we had an aide that came in to assist her daughter who was in her mid 60s. And that aide happened to be African American. And so all was well. You know, she knew the culture. She knew what not to say. There were no statements that people didn't realize were hurtful. So that worked well. It was when we had to go back and forth with the hospital and nursing homes that they encountered some folks who there was this perception of racism or discrimination or not doing something for my family member because he or she is African American. But then there was this other issue that we dealt with quite a bit. And again, because I was knowledgeable of these things, my background is social work, by the way. So I'm trained to know about resources in the community, in addition to being in healthcare. But there was also this perception of, is grandma or great grandmother going to get the care she needs and deserves because of her insurance? You know, she had Medicare, and I kept saying she has Medicare, so certain things are going to be paid for and certain things are not. But there was this perception that once we had Medicare, everything was going to be taken care of. And I think a lot of people think that. And so, but nowadays, certainly more education is helping folks to know that you do need supplements to help with your Medicare plan. But anyway, I was mindful of all those things, but still having to make sure that my family member understood that they didn't talk to you about removing our great grandmother from the ventilator because of her insurance or because of the color of her skin. It really is because of the health condition that she's in. And the research shows, and so it's that, again, all about that translation. But unfortunately, many of us don't have translators in our families. Right. So we leave those experiences with that history. And every time we re-enter the health system, that history comes back.
No, thank you. And Pat, it makes me think about, your brother-in-law, many others who have happily been able to survive that initial crisis of, we have treatment for the diagnosis of HIV and so many other things. But now the LGBTQ plus community is aging. And I think about now as a caregiver, I am seeking care, maybe inviting somebody into my home, maybe seeking placement out of the home for me and my spouse, my partner. I wonder how the past experience is something that can be impacting those that are thinking about, well, 20 years ago, 30 years ago, how do I feel safe now? And we know that there are realities for those, couples and not only LGBTQ, but other populations we can talk about, veterans, so many others. So how does our past history then influence our decisions as caregivers or our concerns?
It's so interesting that you bring this up, Risa, because again, I was out on the West Coast because my brother-in-law and his partner were thinking of moving into an over 55 community. And so here these two guys are that are kind of touring around, looking for communities in which they felt comfortable. And keep in mind, as I said earlier, my brother-in-law left Boston so many years ago because he wanted to be in a more welcoming and comfortable community. And so some of the decisions that they made, selling their home in LA, and then finding another community which could meet their needs at multiple points in their process, in their life process. And, going to some communities where they didn't feel at all comfortable or welcome, the tour person is saying, well, I'm not so sure that you're going to really like this here. It might be that the homes are not quite what you would want. And this sense of, so what makes you think I wouldn't want these homes? And I actually steered them towards Sage, just to kind of discuss with some people, am I being discriminated against or not? And it's very interesting that so much of this still exists. And I will say that the community that they settled on is a very diverse community and they're very happy there, but there was a lot of trial and error along the way. And because of past experiences, as you said, they just weren't sure if they were really being discriminated against, if they just didn't want them there. Yes, we are a gay couple, but we are entitled to the same rights and the same benefits as others. And when you mentioned insurance, the same thing, helping them to negotiate, moving from a traditional insurance once they became Medicare eligible, all of those things, if you don't have someone that can help guide you, then it is very difficult and you are afraid that you're going to lose something. They were fortunate because they did have Kaiser. Kaiser then moved them into their over 65 Medicare plan, and it worked out. But again, anxiety with any change like that you're going to lose something that you've worked so hard to gain.
So you mentioned SAGE, which is a group that is available, we know, nationwide for the LGBTQ plus community. And I wonder, when we think about groups, who we gravitate as a caregiver to gather information from. So if we think about another group, often that has resources available, but perhaps we don't always know how to access them as a caregiver. And I'm thinking about our veteran community. And I know, Pat, you have worked extensively in the veteran community and both professionally and personally in terms of, as a caregiver, it's that I want to be respectful, yet I want to get my loved one and myself what is available to me, and not just navigating it, but being able to be an advocate and have a voice for that.
Yeah, Thanks for that question, Risa. And actually, I just want to provide some context for that. There are well over 18 million veterans in the United States. And according to the VA, only about 6% of that number receive all their care from the VA system, and a little over 6% receive some of their care. And there's clearly over 86% that receive no care from the VA. So the question is why? And both from the veteran's perspective and from the caregiver perspective, it's complicated. There's a lot of misunderstanding and confusion about even the application process for the VA health system, and you have to be patient. It's government. That's just the way it is. And there's lots of forms. And, you know, one of those forms is that DD-214, which is your discharge form from the military. And if you don't have that, it takes some to get it. You know, the other thing is there's been prior negative information about the VA health system, wait times, poor care. There's also limited facilities, especially in rural areas. In North Carolina, even in our area, there's a number of them that are relatively close, but it's still a distance to drive. And I will talk a little bit later on around the personal piece, but I think that people are not aware that there is a veteran service officer in every single county, especially in North Carolina. Some other states it may be set up a little bit differently, but that is a go-to resource. And that resource can get you your DD-214. That resource can get you the application for the VA system. It can help with any of your benefits. And why take some information off the TV? And I know, Risa, we've talked about this, the scams that are out there. You know, you don't need a lawyer to get your VA benefits. The other thing is many of veterans are still currently working and have insurance through their employer, and they think that you can't apply and you can't have two insurances at the same time. And that's something that's very interesting to think about. But another reason is so many veterans do not want to ask for help. And my husband was in the active duty. He also was in the Marine Corps Reserve. And, you know, as he started getting older, I started asking questions about retirement. You know, don't you get retirement? You've done all this, you know, all this stuff. Well, yeah, I'm sure. And, you know, don't you have to collect some papers? Well, yeah. And the long and short of it is, he really did not believe that he deserved any of those benefits. He did what he was supposed to do. He was part of that Vietnam era veteran that came back and was re-traumatized by the citizens of the United States who protested the war, as he was over there fighting, believing what he was doing was right. But it was others deserve it more. To this day, my husband will not stand in any group when they want to acknowledge a veteran. It is still very difficult. And it is that sense of, you know, I did what I was supposed to do and I don't deserve anything more. And it was only when I said, listen, we're talking about our retirement. And, you know, it's a partnership here. So I have mine, and let's find out what yours is. And in doing so, he was able to talk to the veteran service officer, who was wonderful and very understanding, and got him into the VA healthcare system, sort of against his will, but it has worked out perfectly for him. And he's in a supportive environment and is comfortable. But also, he was able to access resources for my husband that my husband had no idea that he was eligible for. And I think that that's important.
Right, because it not only benefits him, but as you said, it benefits you. And we know that there is a reality of being a caregiver for someone who served, was active duty, whatever capacity they served, that caregivers also can benefit from the services of the VA. And so as we share resources, we will be sharing information about the veteran service officers and the VA. We've mentioned SAGE in different communities, different states, like in North Carolina, it's called Carolina Aging Alliance. We want to make sure people know the resources to go to. And Ursula, I am thinking about maybe a very broad resource within the African American community, and that is the faith community. Having worked in healthcare for a long time, I see the place of the faith community for so many in the African American community as a source of information, a source of assistance, a source of solace. And I wonder if you can talk to us about that.
Yeah, definitely all those things that you just said in terms of what the church mean for many African Americans. I won't say all because we're certainly all very different in our own respects, but there's African American churches who really, I think, do a good job making sure that they have information that the folks that attend their congregations can be aware of in the community. There are many churches around that offer financial assistance, that offer referrals for caregivers to resources in the community. Some churches have what's called Stephen ministers who are trained to go out in the community and provide support and referrals to members of their congregation. And I think for me, Risa, and particularly for my family, the church was a trusted source of information. It was the minister that my great-grandmother knew since he started church. And my grandmother went to the same church and my mother went to a separate church. But again, it was that sense of family that the church represents too. At least in my family, it did, as well as that trusted source. So because all three of the ladies that I was caregiving for lived in rural areas, I will say that finding resources was a challenge for me, as I looked outside of the church, because there was so much that the church could do. But I needed those professionally trained people to come into the home and help with the caregiving situation. And again, it was there, but it was limited in what it could do in terms of aids in the home and whether or not, because of course Medicare doesn't pay for that. And some of my care recipients did not have Medicaid. And so we had to scramble through what eligibility requirements are for many services out in our community. Again, I have to reiterate, for my family, I think having me there to help navigate those waters and know how to immediately go to the internet and find the resources that we need. And then it just becomes a matter of, are we eligible for those resources? And again, coming from a rural community, what I will say is that with both my great-grandmother and all three individuals we used to church, but with my grandmother and my great-grandmother, we definitely relied on the Area Agency on Aging, and every county in North Carolina is represented by an Area Agency on Aging. And so you can Google that for your particular area and call that Area Agency on Aging to find out what resources that serves caregivers or older adults or whatever type of care recipient that you have in your community. And they have a lot of funds that are given to specific agencies within the local areas to meet needs. And so that is a good place to at least start. If I had to say to a caregiver, where do you start? Besides the church, where's a good place to start? And that would be the Area Agency on Aging, particularly if you're caring for an aging person or if you are an aging caregiver yourself, or again, like you're caring for someone who's an older adult. There are others, opportunities that you can look into for resources. I always encourage people to use 211, which is a resource line, just like 911. You call and you describe the situation that you're in, and then they give you information about local resources in your community that could help meet your need. Again, all this information comes real easily to me, but when you're dealing with people who are not a part of the health system, do not have a background like social work like I do, finding these resources are overwhelming. And then having those conversations about eligibility, not to mention the fact of trying to get your loved ones to accept help. Pat, I know exactly where you're coming from. I literally had to beg at least two of my caregivers for help. My mother, I basically threatened to stop being her caregiver if she did not allow me to call hospice. Clearly, with her cancer diagnosis, she was eligible. I was an employee at hospice at the time, and I thought, how crazy is this? I'm an employee and can't even convince my mother to get hospice care. And it came to the point of having to threaten to not be her caregiver anymore, knowing that I wouldn't do it, but I had to do something drastic for her to agree to it. And what a blessing. And I can't emphasize this enough, what a blessing it was to have hospice, because all the resources, if I did not know about them, my social worker or the team members that provided that support to my mother and my family. That's the other beauty of hospice. It's not just about the person that's dealing with this serious illness. It's also the family members. So I was really, really encouraged to stop being the healthcare provider or the healthcare expert and be the daughter. And with my mother, I really felt like I came to grips with that and was able to do that because of the wealth of resources that I had available to me here with the Greensboro hospice program and the other services that she benefited from. Unfortunately, my grandmother, who died of congestive heart failure, did not have any resources in spite of my efforts. And when I tell you I made many efforts, I did. And so much to the point that I called and reported some agencies to the state because I felt like it was just not appropriate that they would not serve my grandmother for whatever reason. Sometimes it was, well, she's not sick enough, or it may have been that the certain exam score or what have you was not the right one, so therefore we can't serve her. Her income is actually too much. She was one of those donut hole folks who fell in between and didn't qualify, made too much money to qualify, not enough to take care of her needs. So, but again, we pull the information or the resources that the church had, and that's what my grandmother, who had no professional resources from the community, relied on. I myself relied heavily on the resources of AARP. They have a fantastic website with lots of information, particularly even about the type of illness that your loved one is living with. That it narrows it all the way down to that. It gets information on caregivers who are asked to do personal care. How do you lift people? How do you take blood pressure? I mean, it's just a wealth of information on the AARP website. And social services. I want to really put a plug in here for DSSs in communities. I think people have this false understanding of DSS is only a place for Medicaid and for poor people, etc. DSS is a wealth of information about caregiving resources as well as taking care of your loved one. There are divisions within the department outside of Medicaid that can do so much in terms of in-home services. They can help with nursing home placement if that's necessary, but there's just a lot of resources. And I would really encourage caregivers to call their local DSS referral line, explain their situation, and then let the person answer the phone explain what might be available to them. But first and foremost, I would start with the Area Agency on Aging, and then certainly the church, and then DSS. Those would be my top three to get you going. Now, you may get information about a wide variety of things, and just take your time, digest it, sit with other people, talk about it, because it can be overwhelming if you're not used to dealing with healthcare and resources in the community to help you care for a loved one.
Right. Thank you. I I'm thinking about hearing that from you, hearing that hospice was so beneficial. We know that the African American community is underserved by hospice, and I can't help but wonder, some of it is the societal, no, we don't want hospice, but there is something more than that within the African American community, and I have to believe that's historic treatment within the medical healthcare system and treatment.
Yeah, yeah. And for my family, I heard that, no, we can't do that. That's the place to die. When you go in hospice, you're going to die. And I mean, they felt like immediately you were going to die, my mother was going to die as soon as I enrolled in hospice. Again, a trained hospice professional like me had difficulty helping my family get past that, get past those misconceptions about end of life care, and particularly about hospice care. But I do think, Risa, you did hit it on the head. Is that mistrust. It's not just with the hospitals or the nursing homes. It also happens with hospice care and home care and whatever kind of health care a particular person might experience. You always need to at least have in the back of your mind that may be going on somewhere in the minds of one of those family members, and just be as culturally sensitive as you possibly can when dealing with anyone, but particularly folks from disadvantaged populations. Yeah, hospice care. So the other thing too, Risa, that with my family with hospice care is there was this, I think I would say, a spiritual aspect to it. The notion that if we go to hospice, that means we've given up on God, possibly, that He can heal, and going to hospice means that healing is not going to occur. And so for me, it really was involving my spiritual support, my chaplain, my minister, the hospice, as well as my church minister, to really help my family members sort through that and help them come to an understanding that there is healing that occurs in hospice. It may not necessarily be the one that we desire, but there's healing, and helping my mother also talk through the emotions that she was going through, because we were taking our lead from her in terms of where she was emotionally. And so when she eventually came to terms with it, some of the other family members were able to as well. But again, that was with the help of spiritual support persons like chaplains and pastors who were able to come into our home and support us.
Okay. So Pat, when we think about caregivers, as we've been saying, there are so many different, pressures that come to bear. I want to do what is right and best for my loved one, yet I need to be supported. And sometimes it can be difficult to discern what are those resources that I should be turning to. We've mentioned some of them, and we'll share them, but one of the things that I am sensitive to, I know that you are sensitive to, is that when we are a caregiver, we are in a vulnerable place. We are in a vulnerable place where we could be taken advantage of. And how do I know who to trust letting someone come into my home? Or how do I know whether I should, click on this email? And one of the things that we see, unfortunately, are some scams that really do target, I think, some particular populations, whether it is our veterans or whether it is our older adults or perhaps our undocumented members of our community. And if you could speak a little bit about, if I am a caregiver, really being aware and alert to those realities, and then knowing who to turn and trust.
Yes, I think this is really important, because it seems of late we've just been deluged with all of these things around veterans, the Camp Lejeune issue. That's our own issue here in North Carolina. And as any veteran service officer and any part of the VA will tell you, you do not need to pay a lawyer to get your benefits from, any of these issues that are going on. And Ursula mentioned AARP as far as caregiving. AARP is a wonderful resource to sort out scams and any potential frauds. And I think just being aware, don't jump at anything, try to validate it and go to your trusted sources. Go to your veteran service officer and just say, is this legit or not? Talk to your healthcare provider if you're in the VA system, and try to ferret out before really jumping into that. But I think that oftentimes what you see is caregivers who are so overwhelmed that it looks like a quick fix to the situation, and specifically, say, the Camp Lejeune or say VA disability benefits. You've got somebody on the television that says, just call this one number and we will take care of everything. And as I mentioned earlier, there are forms. It is sometimes difficult to navigate through the VA system, but it is able to be done, and there are a tremendous number of outreach workers within the VA system. There was just a notice that came through that there's going to be an outreach event during the month of June, and people are going to be there to help you negotiate and navigate the various systems within the VA.
I think if we broaden the conversation out, Ursula, and I think about being a caregiver, being an advocate, but how do I take care of myself? I am, trying to sift through not only the particular situation that my loved one needs care for. I have the lived experience of my family, perhaps of our family history. How do I take care of myself in terms of getting support, being able to say, I deserve to be cared for as well. And again, you being a healthcare professional, but you being a caregiver, that's a very difficult path to walk.
Yeah, it certainly is, Risa. And, many caregivers experience some of those same challenges of being a caregiver, whether it's managing our time, because we're pulled in many different directions. And some of us are still working while caregiving for others and raising our own families. We're dealing with emotional and physical stress, our lack of privacy. That particular care recipient has moved into our home or we've moved into their home. Financial strain for some caregivers they're dealing with, sleep deprivation. I know it was a biggie with me. And then for some of us who are dealing with it, maybe some depression and isolation. And if caregivers don't hear anything today, I hope that they hear that they deserve to take care of themselves. It's like the airline stewardess that says, put your oxygen mask on first before you try to help someone else. That is just so real in caregiving. I cannot tell you the number of caregivers who I've worked with through the years who have died before the care recipient because they failed to take care of themselves. And in spite of the information that's been given to caregivers, we somehow feel like we have to put everyone before ourselves. Not, again, thinking that we could surmise to death ourselves. So I really want to force how important it is as caregivers to take care of ourselves. To get away is a biggie. Take respite. I don't care if it's just an hour to walk around the block. That's critical that you get away from that caregiving experience. And when you get away, don't have your mind on the care recipient or the caregiving situation. Really get away and do something you enjoy. That's just about you. And as you said earlier, Risa, certainly getting the support that you need. I want to talk about that support from a professional standpoint, which we've been talking about already. But here for African Americans, I really want, and everyone, I really want to focus, I really want your attention to utilizing the resources of your family and friends. Many family and friends, I'm sure, for those caregivers who have them, will say, call me if you need me. I'm here if you need me. Let me know if you need some help. And I know for me, it was a matter of pride. In some cases, it was like, no, I can do this myself. I'm a professional and, I don't need anybody's help. But it quickly dawned on me that yes, I did. And through the help of others and letting go of the situation and being the daughter or the granddaughter, I was able to come up with a list with the help of the care recipient that I was caring for at the time. And I did this for each one of them, a list of all the things that if people wanted to help with, they could. And so when they asked, what can we help with? Is there anything we can do? And I was, oh, got a list for you. And whatever you can do will be greatly appreciated. But not only did I have to get past that great sense of pride that I can do it myself, I had to get my loved ones past that. Because my family is not a family or was not a family of asking for help. And most families aren't. But we needed it. And I in particular needed it. And I think when I was able to put it back on me as the person that needed it versus the care recipient, they were able to look at it from the standpoint, okay, well, Ursula needs the help, not me. I mean, she's doing a good job with me and I don't need these people, but since she needs the help, I'll go ahead and help her. And if you have to play that game, you play that game. But you've got to get the support that you need. And you got to have whatever it is that you need available to give to someone that says, I'm ready to assist. Support groups, I cannot emphasize those enough. Wellsprings Solutions Memory Care, I believe, offers support groups for caregivers. And I believe their website is going to be on some of the resources that we have available to folks. But that's just one thing. Talking out with people, that's a biggie. Get it off your chest. Sometimes it just helps to talk to a confident someone and don't feel guilty if you've got a negative thought about this caregiving experience or maybe even about that care recipient that particular day. That's normal and it'll be okay.
Right. And so when I think about a caregiver, admittedly, my brain goes to the adult. But Pat, we know that there are children, there are teens, there are children of all ages in a home where care is being provided or a parent is serving as a caregiver and I am therefore as the child being involved. And I wonder if you could talk a little bit about the younger person who is in the position of feeling responsible to help with care or feeling somehow impacted and how we can support them.
This was brought to mind and brought to the public's attention, I think, in a 60 Minutes episode, and I believe that will also be on the resources. And it was entitled Children of War, and I was really unaware. There are over 2 million children under the age of 18 living with a disabled veteran. And I think it's very important to acknowledge that disabled. Essentially, their dad or whoever left as their dad, but returned home different. And that whole issue of being different, and they expect their parent especially to come back as they were. And then they realize that the other parent now is in a caregiving role, and a pretty dramatic caregiving role. And in that respect, they can't understand, but they see the change in their family dynamics. And I think that it is very hard for families sometimes to acknowledge, because military families exhibit the same stoicism, pride, independence as the actual service person. And so they may not even know what kind of help they need, but they know that they need help. And as we saw in that 60 Minutes episode, the Elizabeth Dole Foundation is really focused on care and support for the caregivers. And they have created under the Hidden Heroes a caregiver journey map to help people understand exactly what's happening. And that map has 3 stages that are articulated, and it's becoming aware and adjusting to this new normal. Seeking help and shifting priorities. You now have to have help and do things differently. Much like what Ursula said in her list, families need to be able to ask for help. And then you develop a new rhythm within your family. But recognizing that children have different needs than the spouse, different needs than the veteran themselves, and being able to find that support within your community and being willing and able to ask and accept it is something that's very difficult. I think, too, one of the other resources that I wanted to mention that I have used both personally and professionally is Opus Peace, that was developed by Deborah Grassman, who was a nurse within the VA system focused on hospice and palliative care. And it really helped me to understand the invisible injuries of military service and being able to understand the needs of veterans, of a veteran spouse, a veteran parent. And so I think there are more and more resources becoming available as these particular situations are coming more and more to the forefront.
Thank you. This has been such a wonderful conversation that we've had, and I'm sure we could continue on with it. I want to say thank you. I want to, again, highlight the fact that we will be sending a follow-up that will have access to this recording and also resources. I want to, again, emphasize what both Pat and Ursula have said, which is that it is sometimes us making that connection and remembering our youth, not only the adult caregivers in those situations, but Ursula and Pat, thank you so much for sharing your not only professional selves, but your personal selves with all of us today, because I think it is hearing from people who have actually walked this journey that is so helpful. So thank you both for joining us and being a part of this conversation.
Thanks for the opportunity
to be here. Thank you.
I also want to thank everyone who has joined us for all three parts of our caregiver conversation, perhaps just for today. All three parts are available for viewing and sharing with others. I also want to bring everyone's attention to the fact that we are going to be starting in July a 3-part series. It will be on the dementia journey. We know that many caregivers, others are facing the reality of a diagnosis of dementia. And so we will be focusing in a 3-part series looking at normal aging versus dementia. Then we will be moving forward to thinking about the ever-changing needs of someone with dementia, and then looking at guidance for how can that experience be as improved and as good as it can be. So please look for more information. That first session will be on Tuesday, July 16th. So thank you for joining us. I want to end with a quote that says, "Of all of the forms of inequality, injustice in health is the most shocking and inhumane." And that was said by Martin Luther King Jr. And everybody deserves to have dignified, supportive, respectful care, both as a care recipient and as a caregiver. So thank you for joining us today. And we look forward to having ongoing conversations in the future. Thank you.